Are you interested in a role in office ergonomics but don't know if it's quite right for you or how to get a position in this? Well, in this video, I'm going to show you how, as a PT, PTA, OT, or CODA, how you can get a position in office ergonomics. I'm so excited. Okay, so first, what is office ergonomics? So there are two settings in ergonomics, really similar to how there's acute care, acute rehab, skilled nursing facilities, and therapy. In ergonomics, it's the same thing. Office deals with, like it sounds, more office setups, more stationary setups where you're looking at computer height, desk height, chair, all those different surroundings, versus industrial ergonomics deals with more manufacturing, pharmaceuticals, shipping, different things like that that are more maybe mobile. And so you'll be looking at the risks and trying to prevent injury in these two different environments or two different settings. So for this video, we're going to be talking about office ergonomics. So why are you, as a physical therapist or assistant or occupational therapist or assistant, perfectly trained for this position? It's because you've already been doing it. So think back to your patients. Haven't you maybe treated carpal tunnel or maybe a neck problem? And what was the real root cause? Was it the neck? Or was it maybe how they were typing every day on the computer, right? So indirectly, you have been performing ergonomics because you have been trying to treat the root cause, which is that poor office setup that so many of us, even myself, have. So you have indirectly been doing ergonomics. And that's why it's so easy. And I'm so passionate about people transitioning to it because you already have the skill set. You are the anatomy and musculoskeletal expert. So now all we have to do is give you some of the more regulatory information, like the OSHA rules and the assessment tools. And boom, you are off to the races with an office ergonomic job. Now, that's what is office ergonomics and why you're perfectly positioned. But why would you even want this? So there's a couple really awesome benefits. One, it's prevention. We all secretly wish we could do prevention, right? Because then it would stop all that pain and injury, and we could actually be really helping people. And so this is a way to really help people through preventative endeavors. Two, no insurance. This is more prevention based. So, although you may be sometimes working with worker compensation cases, 90% of the time, it's not insurance. And it even depends on your role. It may be 100% of the time you're not dealing with insurance. So, the third reason is that this pays similar, if not better, sometimes a little less. Don't quote me, but it pays similar to what clinicians earn right now. So this won't be a pay downgrade. This will be better. Fourth is the fact that this is usually strictly a 9 to 5 job or 8 to 4:30, whatever you want to say. But there's none of that extra time like we often spend in the therapy clinics. When you're done, you are done. And there's a lot more benefits, but I think that's some of the main ones. You still get to use your clinical skills, but it's not as physical either. I forgot to mention that. And I think that's a big benefit for a lot of you who are looking for something that is less physically demanding because it is tough. So that is some of the awesome benefits to office ergonomics. Now, why and how can you get this role? So if you go on Indeed, you'll actually find that there are a lot of positions out there for you. If you go, you'll see positions like this one that say for PTAs, PTs, OTs, and CODAs. It's so awesome. We just have to start looking. Now, I will say that you may need some extra certifications. Luckily, it's very little compared to a lot of other career transitions. You don't even need necessarily any more education, like I said, but this can be sometimes a competitive application process. So it would help to have some other certifications to help you ace that interview, to help your resume stand out more. So if you go to the OSHA website, there's the OSHA 10, which is a 10-hour course that you can take on a lot of the OSHA regulations and rules. We also ourselves have created 2 certifications. One in office ergonomics called the Remote Injury Prevention Specialist certification for office. And then another is the Remote Injury Prevention certification for industrial ergonomics. Both teach you remote and on site how to perform the assessments for office or industrial ergonomics. Now, you don't necessarily need these certifications, but I do think they'll help you get the resume through the applicant tracking system, ace your interview, and also more confidently perform ergonomics in that setting or in that facility that you've been hired for. I really hope I have inspired you to take this leap. If you have any questions, let us know in the comments below. Thank you so much. Bye bye.